Good morning, everyone. I'm Deborah Garlick from Henpicked, and welcome to our Lunch and Learn for today. And I'm delighted to welcome Dr Nicky Keay, an endocrinologist with us. And what we're going to be covering is menopause, COVID-19 and testing. So welcome, Nicky. It's great to have you with us.
Thanks very much. And I'm really looking forward to discussing with everybody.
Thank you. And tell me, what is an endocrinologist and how did you get into it?
So endocrinology means the study of hormones. And when I was doing my medical training and deciding which speciality I wanted to focus on, hormones to me were the most interesting because they're very challenging. And that's part of the appeal, I suppose, because you can't see them, you can't feel them, but yet they are essential to your health. And they're circulating inside your bloodstream. And they are very complex. So it's very much, as a doctor, like detective work, trying to work out what might be causing a person presenting with some problematic symptoms. And of course, the most complex and therefore the most interesting of all the hormones are the female hormones. And they are absolutely incredible and fascinating. And that's really why I was drawn to studying hormones, because they are so essential to people and because it's tough to try and unravel what's going on sometimes.
So from the day we're born to the day we die, whether we're male or female, we have hormones influencing absolutely everything that we feel, do, how we behave, everything about our day-to-day lives.
Exactly.
And you mentioned the female hormones. One of the big hot topics at the moment is, of course, COVID-19.
Yep.
And something that some of us were reading in the press is around estrogen providing us with a certain amount of protection against COVID-19. What can you tell us about that?
Yes, well, you're right. I mean, first of all, any discussions about COVID, we have to say this is a very new virus, and we're still learning literally every day all the details about it. So we can't make absolute, definite statements, but certainly the indications are that estrogen is protective in some way we don't fully understand. And this was actually put forward by the Vice President of the Royal College of Obstetrics Gynecology, so coming from a top source. And the reason for that is that it does appear, if you look at the statistics, that men seem to be more affected or infected, should I say, than women, and also tend to have more severe symptoms with the COVID infection. So that has led to the suggestion that estrogen might somehow be playing a protective role and enabling your immune system to function.
You say maybe, we don't really know yet, do we, enough?
No, well, I mean, just as I say, from the statistics, people trying to work out why is it that there seems to be a higher incidence of the infection in men than women, and what's the big difference between men and women? The hormone, those particular hormones, the sex steroid hormones, estrogen, and that I believe is where that where that's come from.
Okay, so you mentioned earlier about your fascination with female hormones, and I know whenever our team are doing training in menopause in the workplace, one of the things that the hormones that we tend to talk about are estrogen, progesterone and testosterone. What can you tell us about those three hormones?
Sure. So maybe we should go back a little bit further than that. So what controls your hormones? The hormones, they're released from various glands around the body, and this of course includes the ovaries in women. But what controls them? And actually the boss of all the hormones, it was described during I remember as a student, it was described as the conductor of the orchestra. So the boss of the hormones it's what's called the pituitary gland, located in the brain, and that secretes control hormones. In the case of the female hormones, those two controlling ones are FSH and LH. follicle stimulating hormone, luteinizing hormone. Those act in turn on the ovary, and absolutely they produce the hormones that you've just mentioned, the estrogen, the progesterone, and a bit of testosterone. And those are the ones that then go on to have effects in the tissues throughout the body. So whenever we talk about the female hormones, we have to sort of remember there are always control ones. And for the whole system to work in its beautifully synchronized fashion that it does from when you start your periods, when you're age 12 is the average, and up until the time your periods stop, menopause, average age 51. So throughout that time, the body is amazing. It has this beautiful regulation between the control of the pituitary gland and the response of the ovaries. And that goes through that lovely cyclical pattern of hormone release that I think we've probably all seen at some point. And so that's normally, that's what happens during those years. But then, of course, when you come to the menopause, what happens is that the ovaries become a little bit recalcitrant and not obeying the control hormones, and they don't secrete those hormones that you have been used to having in circulation for all those years of your life between the age of 12 and 51, say. And that, so if you think about it in that context, it's not surprising that when the menopause occurs, yes, it does really affect how you feel physically and mentally, because these hormones have been with you for all those years, and suddenly, they're in decline, and they have effects, as we've discussed, throughout the body. I think we're all familiar with, the effect on bone health. Cardiovascular system keeps that healthy, and they are neurotransmitters as well. So no wonder when these hormones, aren't with you anymore. That's why you feel, different.
And I'm really pleased there that you talked about both the symptoms of menopause, when I think you said yesterday when we were talking about your body feeling bereft,
yes,
at the change in these hormones. And it's not just about symptoms, is it? It is the longer term health. You mentioned between 12 and 51 is when we might be having this wonderful cycle of our periods. Then suddenly things can get a bit bonkers.
Yeah, exactly. And so it's a bit of a shock, literally, to the system in all respects. But I think the interesting thing that we also sort of talked about yesterday is that because of the increased life expectancy of women, up to a third of your life is probably going to be spent in the menopausal state. And, back in the probably let's talk the Tudor age, women would often die in childbirth, and frankly, they would very rarely get to menopause. So, women, we didn't realize that what would happen, as it were. But now, of course, living longer, lots of women will be living a lot of their life in the menopausal state. And that, by the way, that's not to say this is normal physiology. So it's not that it's some disease or condition or something like that. It's just normal physiology. That's the way the women have evolved, that your ovaries they've been working very hard, and they've just had enough. And obviously evolution says that it would be difficult to give birth to a child and look after it if you are over 50. So I suppose we could say maybe that's the evolutionary reason for it. But nevertheless, it is. So first of all, I think, that's normal physiology. And so we shouldn't talk about it being some condition or something like this. And it's just a case of accepting or being aware that this is normal physiology. And yes, we're not minimizing that it's a challenge, by the way. It certainly is. Speaking as a 54-year-old, certainly it is. But it's just then you have to look for different strategies, what's going to suit you to get to terms and live your life to its fullest in this slightly altered state.
Absolutely. And of course,
hormone wise, I mean,
for so many women, it's a natural stage in their life. And for so many, it's induced by surgery. So things can be dramatically changed very, very quickly. But I agree with you. I think we are in a very different time. We are on average living to be at 83. We stand a 1 in 6 chance to live to be 100. So you could be 30, 40, 50 years post-menopause, and that's something that has never happened before. Which brings me on to what does this mean for menopausal women? I think we just lost Nicky there for a moment. There you go. We've got you back, Nicky. I think the airwaves, please bear with us. This has only happened to us once before. This is due to everybody being on Zoom or GoTo, I believe. The airwaves need to be bigger. There you go, Nicky, welcome back. Just check from a sound point of view. Can you hear us, Nicky?
Yes, I'm sorry, I don't know what's going on here. Apologies
That's
if it's my end, I don't know. Anyway, I'm back. Where did we get to?
We got to what does this mean for menopausal women? And I guess that's leading on from the question about estrogen providing us with protective hormones. So I think as a post-menopausal woman myself, I'm thinking, so what do I need to do? Do I need to get my estrogen topped up? Do I need to know where I am to know if I've got that protection? Or should I be thinking about it more globally than that, more in terms of managing my menopause generally? Hello, Nicky. Hello, Nicky, can you hear me?
Yes, I can. I'm really sorry about this. I don't know if it's my internet or what's going on.
Hello, Nicky, can you hear me?
Yes, I can. I'm sorry about this. I don't know what's going on, if it's my internet or
We can hear you now.
I might move room if it doesn't work.
Well, we can hear you now. So I guess the question is, what does this mean for menopausal women? And that was specifically relating to estrogen deficiency. Could you please bear with us, everybody, on this Lunch and Learn session? We're just, looks like Nicky is moving rooms to get closer to the internet signal. We'll be with you in any moment. For anybody that's not been on our Lunch and Learn sessions before, we'll send you a newsletter after this, so you'll be able to watch this again, so you can scroll back and forward to the parts that are of particular interest to you. And there's also my colleague Sally, who's in the background. So if you have any questions ready for the Q&A, please do use the Q&A button. We'll endeavour to answer all questions at the end of the session. And if we don't get to all of the questions, we will drop you a note afterwards to give you any responses in there. And just to recap on what we're talking about today, we're talking about menopause, COVID-19 and testing. And for many of you who've read the papers, and certainly people in our community that have talked about whether estrogen gives you extra protection, what Nicky was talking to us about as a team yesterday is, yes, there is some evidence to suggest that estrogen does give you some elements of protection during well, up to menopause or during COVID-19. However, there's still a lot of work that needs to be done to understand more about COVID-19 generally. So, you know, not 100% guaranteed. And yesterday, Nicky and I were talking with the Henpicked Menopause in the Workplace team about, so as a menopausal woman, what does that mean? What do you need to do? Is it appropriate for you to be going to your GP and saying, well, actually, I think I need to have extra estrogen to give me protection during COVID-19? But where we got to was a woman's menopause is actually thinking about symptoms and long-term health generally. So rather than asking the question, how do I get extra estrogen to protect me against COVID-19, one of the most important things that we can all do is start to think about our overall long-term health and symptoms. So thinking more holistically about how do you manage your menopause. Hello, welcome back, Nicky. Can you hear us now?
Yes, I'm sorry about that. I've reconnected my internet. Really apologies, everyone, but it sounds like you've been carrying on anyway. So
I have, and actually, I know you did the training session yesterday for our Henpick team, and I was just saying that, just to recap, COVID-19 is something that we're all very concerned about, but rather than us all running out and asking for estrogen top-ups from our GP, that we ought to take the time to think more holistically about how do we manage our menopause, both its symptoms and also long-term health.
yes, because there's more, I mean, estrogen, as we said, does seem to play a part in immunity, especially for when we're talking about COVID-19, but actually there are lots of other ways to keep your immune system healthy. So like you said, looking to keep active, continue doing whatever exercise you are, eating as healthily as you can with, fresh produce, and sleep. Sleep is really important for rebooting all of our hormones. So there are lots of things that we should be doing anyway, frankly, to keep our immune system in top notch. So yes, we shouldn't look to taking HRT as that's going to be the miracle preventing you from getting COVID. I'm afraid, you have to be looking after your health in other ways as well. That's really important.
Yes, and you mentioned lifestyle, and you mentioned vitamin D.
Yep,
And other things
absolutely.
that influence your immunity during this
Yeah,
time.
definitely. Vitamin D is a very interesting one. I mean, even before COVID came around, there is very good evidence, especially in athletes, that if the vitamin D is a bit low, then that affects immunity, and you're more unlikely to get infections, viral infections over the winter months in athletes. This is. So, and unfortunately, fortunately, unfortunately, the downside of living in the UK is that we don't get much sun. So even if and the action, how you produce vitamin D is the action of sunlight on the skin. So that's a bit of a problem. And even if you were to walk around naked all of winter, you still wouldn't get enough sun on your skin to produce vitamin D. And that's why Public Health England actually recommend we all take vitamin D supplements over the winter. But frankly, also just looking outside at the weather now, personally, I take it all year round because you can't always be able to get sunlight on your skin. And the immune system is so, the vitamin D is so good for the immune system, and also it's the other benefits of for bone health, which is, and bone health, of course, is one of the things that we are concerned about as menopausal women. We have to be aware that, your bone health will decline. And so doing other things that you can to keep it as strong as possible is obviously important.
Thank you. So yes, the long-term health being heart health and bone health. So when we're thinking more holistically, we should be thinking about ways of balancing our hormones to reduce symptoms, and thinking about long-term health, what we can supplement it. I'm going to move on to the final question, actually, around the guidance on testing. But one of the questions our team had yesterday was about resistance training for long-term health benefits, and also for bone. How was your ballet class last night, Nicky?
Oh, great. I mean, yes, like we discussed yesterday, I mean, definitely as we get older, we should all be doing more resistance training, as my cycling coach son likes to remind me, both that I'm getting older and I should do resistance training, because it's very important for your bone health, but also actually it's very important for your body composition to maintain muscle strength, muscle mass, and avoid sarcopenia, which is decline in muscle strength, muscle mass. But if you're like me, and you don't particularly like going to the gym. I don't mean I'm advocating everyone out there goes and joins the gym and starts doing deadlifting and all this thing. If that's your thing, by the way, great. But if it's not, like me, then actually you can do it other ways. I mean, for me, ballet, exactly, because hopping, even just doing a couple of hops a day, is being shown to help bone health. So I do that in my ballet. We move around, we jump around, we change position. And also the resistance side of it, you don't have to be lifting heavy weights. You can just have little hand weights or just a water bottle like this, which is filled up, to do some lunges or things like this. Resistance bands. I'm also a Pilates teacher. So there are other ways of doing it, but definitely you should be.
You should be, yes.
Yeah.
We often get the question, what exercise is the best exercise for menopausal women? And we say the exercise that you do.
And also the exercise that you enjoy is the other crucial thing. There's no point, you know, having worked in the NHS for so many years and, you know, trying to encourage the diabetic patients to do exercise. And my starting point is, what type of exercise do you like? And even if they say nothing, then it's like, well, let's find something that's enjoyable to you. A walk around the block even would be a starting point. So, of course, so the first thing is do what you enjoy, right? And the second thing is try and mix it up. Don't always do exactly the same thing, which is another thing that I'm also told. Don't always do exactly the same swimming session when you go to the pool. Anyway, so try and mix it up and have a mixture of things that include things for cardiovascular health, like walking, jogging if you want, swimming, cycling, those sorts of things. But also important to include in there some type of resistance exercise, whether it's the gym or whether it's some little exercises at home, Pilates class, yoga class, something like that. So I think that's something you enjoy, and also try and mix it up.
Thank you. And the one thing that we think people should do all the time, because one of the biggest questions we get from women is, how do I know where I am? Where am I on the journey? It may well be that they're taking contraceptives, or they're not sure that they're going through perimenopause or a post-menopause at this time. And we know the government guidelines and the NICE guidelines say that for a woman who is otherwise presenting healthily, that there's no need to do blood tests, because diagnosis should be on symptoms alone. So one thing that we always suggest that women do is keep a track of your symptoms by keeping a diary, understanding what else is going on in your life, because I'm sure we'll hear from you in a moment that other things can disrupt your hormones too. But keeping a list of your symptoms and your progress through this time. I was interested yesterday when you said it may not all be menopause. You also have to think about other things that could be disrupting your hormones.
Yeah, well, I think, and you're right that, you know, it is a clinical diagnosis, perimenopause and menopause, because you know, if you do a blood test in your perimenopause, you might actually catch your ovaries on a day when they are behaving themselves, or you know, and so you might actually think, oh well, and then someone turns around and says, oh well, there's no signs of perimenopause. So that's the argument for that, which I understand. But I think on the other hand, the advantage of doing a blood test is that then you can check up on everything else. So you can check your vitamin D. You can, because that we know low vitamin D levels make impact well-being. You can check on your iron, thyroid function. We know that thyroid issues are more common in women, and as we get older, it's not just the ovaries that become a little bit sluggish, shall we say. So, you know, there is nevertheless a place, I think, for doing a blood test just to check that there's nothing else going on. And certainly if the blood test does come back as a definitive menopause, then that's also helpful to know where you are on that journey. But I think you make such an important point that keeping your own personal log of what symptoms you're getting and when when they're happening, because we know that in this current situation with COVID-19, normally regulating women are reporting more irregularities, simply because the system is, like we've discussed, so amazing and so finely tuned that if there's an external stress, the body doesn't distinguish where the stress is coming from. But if it registers the stress, then our friend, the conductor of the hormone system, if you remember, the pituitary gland, dampens everything down. So, as you say, taking into account what's going on is also important, to keep a log of it, to sort of try and make sense of what's going on, because the person that knows your body best is you.
Absolutely.
So you know, a blood test certainly is informative and helpful, but ultimately it has to be on the background of the clinical context for the individual. So I think that's really important. And also that's important then, because then you feel empowered. Then you feel you put together what's the symptoms you're feeling, or any external things going on, put that together with any blood tests or other tests you might have, and then you can understand the overall picture of what's going on for you.
But of course, they're not always available on the NHS. And as you quite rightly say, you know, I could take it on a day when my hormones are behaving. And, you know, you could take a blood test every day of the month and have a slightly different one. So it's more about having something to track it to. I know Forth do a blood test. I've done it twice myself. So it's quite interesting for me to see before and after.
So definitely, yes. So yes, at Forth we offer the blood test, which will cover both female hormones and all the other things we discussed that can contribute to how you're feeling, thyroid function, lipid profile, vitamin D, all these things. And at the moment, we're developing something that will enable women to be able to make their own personal profile of what their hormones are doing. So we're working on that, because ultimately no one wants to take a blood test every day.
No,
they have done that in studies. They have done that in studies, but we're working on a system whereby you would just do 2 blood tests, and from that one would get enough information to model your own personal hormones. So that's where we're going, because going back to the very start of this, hormones are essential, but actually they're quite personal, if I can put it like that as well. You know, everyone will, of course, that's the way they work. For example, the female hormones normally have this nice cyclical pattern, but within that normal range, you know, you personally might be someone that's higher, lower, and it's all a matter of timing and balance. So ultimately, that's I think going to be the future of where hormones will be, especially the female hormones. You know, to making your own personal log track of them, along with your written log of things. Then you can also even coordinate that with your own personal hormones. So that's where we're going.
Thank you very much, Nikki. Now, I'm really conscious we're coming up to the close, so but we do want to have some time for some Q&A. Are you okay to stay around with us?
Of course, yeah, yes, of course, and apologies for the earlier blip anyway. So
the tiny blip. Well, we all know that everybody is using the airwaves at the moment, and I know the internet providers worldwide are probably really struggling. So thank you, Nikki. So any questions, Sally?
Yes, we've had plenty of questions through. So one that came through was that if estrogen gives a woman some protection against COVID-19, will phytoestrogens have a similar effect?
Difficult question to, I mean, theoretically, yes, but as I say, I don't want to be dogmatic, because it's so early. We're not even, it's only a hypothesis that estrogen is the protective factor in all of this, just to highlight that. I mean, I would really like to dig into the detail and see the women who have got estrogen on board. Is it the estrogen alone? Are those actually also the women that are taking their vitamin D, etc., etc.? So there might be other confounding factors. So I've got to, you know, in answer to the question, why not? It sounds reasonable, but please, I don't want everyone to go away and think that's the answer, to go and get some estrogen of some sort. If you want to, fine, but also please, I think actually it's even more important to look at all the other factors we've discussed, the types of exercise you're doing. Have you got your vitamin D? What else is going on for you? Are you getting enough sleep? So looking at all those factors together would probably be my advice.
Excellent. Okay. And we talked about this on the training we did with you yesterday around testosterone, and someone asked, are there natural ways to increase testosterone?
So that's our friend, the resistance training.
Yep.
I was just reading a book that I think I showed some of you yesterday about. It was called Sports Endocrinology. So what happens to your hormones in sport? And that is the thing. I mean, normally we associate that with men going to do their weightlifting, their testosterone increases, but actually the same applies to a certain extent to women. So, and as we've said, doing resistance exercise is also going to be great for your bone health. So there you go. That's the answer.
Brilliant, excellent. And one of the things, again, I know you've mentioned around some of the other things that we should be looking at. Obviously, when one of the things that's coming up is sometimes it's hard to know whether it's perimenopause that's driving symptoms or if something else is going on. So if a woman presents to you with perimenopausal symptoms, what are some of the core things you would also test for, or that we should also be looking at? And I know you've mentioned a bit about thyroid and vitamin D, which is anything else that a woman should also be looking at to understand what else might be driving how they're feeling, because I think quite a few people are saying they feel a bit confused about whether it's perimenopause or not.
Yeah, well, listen, exactly. It's a very justified question. So, and I do see quite a few menopausal women come and have a chat with me. So, first of all, I think going back to Deborah's point, let's have the log of exactly what they're experiencing. Okay, so is it, the sort of classical things of the hot flushes, difficulty sleeping, the brain fog, just sort of really get to grips with the symptoms. Are those compatible? But then also I would also run a blood test. Also check that they are doing some exercise and they are eating a varied diet, all the sort of basic things, and what's going on for them in their lives at the minute. But then I would run a blood test to check there's nothing else that could explain this. In terms of thyroid would be the top ones, full blood counts, which will tell you your hemoglobin, and also iron, B12, especially B12 if vegetarians, they should be taking supplements, and my favorite, the vitamin D. So just having a look to check there's nothing else, and that put your mind at rest, hopefully. It might be that actually there is something that's picked up that could be contributing to the many these perimenopausal symptoms, like the vitamin D or whatever it is. But equally, if those are all fine, then it's like then you have more sort of certainty that actually this is the perimenopause, and start getting yourself informed. What are the things that you can be doing, to strategies to deal with that? And then also bearing in mind that you will then be reaching the menopause at some point, you can start doing some sort of advanced research and thinking through, your options about HRT and all this sort of thing. So I think just being absolutely as certain as you can be that there's nothing else going on, and okay, this is what it is. I'm not going crazy. There is a reason, and then you can start, working out what's going to work for you.
That's brilliant. Thank you. And that's kind of the main thing that was coming through this, how do we know, which I know you've been talking about. So it's absolutely brilliant. Thank you.
Fantastic. Yeah.
And thank you very much for joining us today, Nicky.
My pleasure.